I want to review what happens at the end of a visit in terms of the electronic medical record note. This is very crucial, both in terms of compliance and in terms of the care we offer to patients. First of all, there are certain things that go along with the end of the visit in a handwritten note that are just translated to the electronic medical record note. For example, at the end of a visit, you're going to decide what new medications you're going to prescribe and what refills you're going to provide. You're doing this currently anyway. We're going to convert that to e-prescribing. You're going to create an assessment. Now, that assessment you can handwrite, you can dictate, but either way, you're going to create a problem list, and those problems need to be incorporated into the electronic medical record, whether your style of note-taking is handwritten, dictated, or completely electronic. Either way, you're creating an assessment, and that assessment means a problem list. You're going to select which of these problems you're going to bill, because on your encounter form, you always put up to 4 items on the billing sheet, and you're going to decide what CPT codes you did. You're doing that currently on paper documentation. We're going to transition over time to an electronic documentation, but it's going to be entirely identical. Now, what's new here is that you're going to be giving the patient a list of their medical problems and their medications. Sometimes you can do that at the time of the visit, but sometimes there's a crunch at the end of the visit and you'll have to mail it the next day. Either way, the patient is required to get a copy of their medications and problems. We're really supposed to also give them the test results as well, but we'll incorporate that as we develop the infrastructure to do that. Health education, of course, is a vital part of your care for the patient. You and I always explain to the patient the things that they need to manage their health. Incorporated into the electronic medical record is a whole host of medical education brochures. I have added in health education information that I utilize in my practice, and for cardiology, we've added all of the American College of Cardiology handouts directly into the EMR. Finally, you have to close the note. Regardless of whether you dictate, handwrite, or use a completely electronic record, every note has to be signed off. Unfortunately, this step has been often overlooked, and we're going to address that at this point and get into some good habits of signing off the note. So let's proceed going through each of these steps. So the medication reconciliation occurs at several levels. New patients come in, and we either ask them what their medication list is, or we ask them to give us their written medication list, and we're going to enter that. That's a medication reconciliation. Other times, the patient's been here before, we've had them on a list of medications, and that list has changed since the last visit. We're going to add some new ones, delete some old ones, update it as necessary. These treatment changes are the medication reconciliation or update. We've always done this. If you don't do this in your practice, you're missing out on a very clear and vital part of the medical visit, that is, that the medication list rarely stays the same. It seems to me that when patients come to me and say, "Doc, my medications are the same," I've found change after change after change on these lists. As a matter of fact, 90% of the time when the patient says they're on the same medications, that means there's a change, and I found as many as 6 changes on patients who say my list of medications is the same. So we're going to focus on the medication reconciliation. That's been part of the medical visit all along. All we're doing now is adding 2 keystrokes to document it. So what are those keystrokes? They're going to go to the encounter form at the bottom of the progress note, and we're going to hit the Visit Extra Info tab, and then we're going to hit Medication Reconciliation, and we're also at the same time hitting Clinical Summary, since we're going to provide that to the patient as well. In my office, this is a function of the medical technician, and they handle all of that. Whether you do this or your medical technician does this depends on whether you specify to them what your expectation of that medical technician is. So if you want your medical technician to enter this for you, you have to make sure that that's their understanding of their responsibility. This is again driven by the physician. And when we say we're going to give them a patient summary, we're going to give them a summary that looks like this, with their name, their list of updated medications, their list of allergies, and their medical problems, all listed. This is something they can take from doctor to doctor and improves the coordination of care. And the clinical summary again is documented on the same page. Health education is in the plan section. It's lower down and towards the bottom of the plan section. Again, in my office, this is a function of the medical technician. I tell them to give them a high fiber diet. They go to diet high fiber, hit print, and the patient is sent home with the appropriate information. In addition to a variety of diets, there is smoking cessation, heart disease prevention. Each of these groups has a number of articles within it. You can certainly give the whole group, which is a number of pages, or you can give a specific item within the group. You should familiarize yourself with what documents are in accordance with your style of practice. You need to be giving health education to 20% of your patients and documenting it. That doesn't mean 20% of the visits, that means 20% of the patients. The patient is there to see you 4 times in a year. Having given them the information on a low sodium diet once will suffice. The drop-down box gives some of the commonly used health education, but some of the ones that don't appear in the drop-down box can be searched for by hitting the Add button. At the end of the visit, it's very key that we close the note. Now, some of you have only a partial record in the electronic medical record. This is okay. If you don't document your exam electronically, but you do it in a handwritten fashion, that's fine. The medical record includes both the scanned parts of the note and the electronic parts of the note. If you want to clarify that, you can use language such as see additional handwritten note or see additional note, because some of it's dictated. There's a shortcut that you can use. It's the letter Z as in zebra, SEEZC, and as soon as you enter that, it will convert to, for additional information, see additional note. whether you include everything in the electronic format or only partial, you need to close and sign off your note. For all of those people who have not signed off notes over the course of this year, you will need to go back and close those notes. The sign off and close is at the top, and it's a little box with a check mark, and you just click that. They'll give you a warning that you're about to sign off the encounter form, and you'll hit yes. It may give you additional warnings of things that you've forgotten to include, and it's very important that you take those seriously and enter those missing pieces of detail. Of course, if patient's in a wheelchair and you can't get a height and weight, that's okay, but the large majority of patients, you should be able to complete all of the documentation that they're asking for and not get this warning.